رمضان طبيبي، معناك جليل بقلب جميل، يحوم النور بأنحائي، يحوم النور بأنحائي.
الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين. السلام عليكم ورحمة الله وبركاته. Welcome back to the medical fiqh of fasting. This is part 6 and will be our final part in the series. Today we will be discussing common medical scenarios while fasting, how they will impact the fast and what can be done, inshallah. The first scenario is a person who has a severe headache while fasting, but he obviously wants to continue, he or she wants to continue the fast. What options are there for pain relief while fasting? So obviously, taking anything by mouth or orally is a nullifier of the fast, will break the fast, so that would not be an option. Anything taken via a suppository form will also break the fast and nullify the fast. The options a person has for any form of severe pain would be an intramuscular injection or even an IV medication to help the pain. So this would be the two options a person could use to relieve pain while fasting. The next is a person who has severe nausea and wants to continue fasting. The question is, can this person use a suppository to help with nausea? We often hear people using suppositories like Valoid, and whether this would nullify the fast. So a suppository would break the fast and should not be used if the person wants to continue fasting. He or she should rather use an intramuscular preparation of an anti-nausea medication. The next scenario is a person who has dry eyes, and as we know, those who have dry eyes often require to put in eye drops regularly throughout the day, and especially in the drier climates and in the days that are very dry and hot, you require putting eye drops regularly into the eyes. Can these eye drops be used while fasting? We've discussed this in a previous part that yes, eye drops do not nullify the fast, and eye drops can be used for either lubricating the eye or as medication. The next scenario is a person that is dehydrated while fasting, and this can often happen with people who are working in very hot climates and in hot environments. Can this person continue the fast, firstly, and secondly, can they use IV fluids? It's important to note that we spoke about the Sharia giving leniency to someone whose health and well-being is deteriorating, or health and well-being will be harmed. Then they have the leniency from the Sharia to stop their fast or break their fast or not to fast. However, if the person wishes to take IV fluids and continue the fast, this will not nullify the fast, not break the fast. There is a discussion amongst the fuqaha currently with regards to IV nutritious medication, and that would be for a separate discussion. However, the current thinking and the majority view is that IV fluids would not break the fast. Another scenario is a person who has a chronic lung condition and requires oxygen throughout the day. Will oxygen inhalation break the fast? So oxygen itself, inhaling oxygen will not nullify the fast. However, often these oxygen machines or inhaling oxygen sometimes is done via a humidifier. It is important to make sure that the oxygen is not inhaled via a humidifier, because the humidified oxygen contains droplets of water, and this would nullify the fast. So if one wants to continue using oxygen, make sure that it is not humidified. The next scenario is a person who uses essential oils for various medical purposes, and this is rubbed into the skin. Will inhaling the essential oils in this regard break the fast? No, rubbing essential oils into the skin will not nullify the fast. We have a scenario where a diabetic patient needs to check his or her blood sugar regularly. Will finger prick and removing blood to test for his or her blood sugar would break the fast? No, this would not break the fast. And can one inject insulin while fasting? Yes, insulin can be injected while fasting and will not nullify the fast. The next scenario is a person who requires a blood test while fasting. Can this be done while fasting? Yes, blood tests can be taken while fasting, and this would not break the fast. Finally, in conclusion, it's important that we've come to the end of the series. It's important that I make mention that all decisions whether to fast or not to fast must be made in conjunction with your imam and your medical practitioner or doctor. It's important that these decisions are discussed prior to making your own decision on these important aspects of our Sharia. Importantly, also the advice given in this series was general advice and on an educational purpose, on an educational platform. However, each individual has a unique situation and therefore should discuss it with their medical practitioner and imam. Assalamu alaikum wa rahmatullahi wa barakatuh.
حبيبي بالأمس وأنت الكون هدى نفح